I'm sure you are aware of Meru Hospice. It's not new to you because you've really helped us in managing our patients. And the patients we have at the moment, there are 520. Among them, we have 18 children. And they have all types of cancers. And the leading cancer is the cancer of the GIT cancers, followed by cancer of the breast, cancer of the cervix, and cancer of the prostate. We've taken care of over 500,000 patients since we started. And actually our main aim is to make sure that even if someone has cancer, will not die of pain. So our services include pain and symptom management, psychosocial support, bereavement support, trainings, and cancer awareness. We want to thank the government of Kenya because they saw the good work that Meru Hospice has done in Kenya, and they called the county government of Meru by then, and they requested that we be given a land. So we have a land at Mwendanto, and it was offered to us by the government. And we also have 2 nurses who are seconded by the county government. We see patients at home. Our services mainly is going to see patients at their homes. And we use a lot of resources. We don't have an owner. We use the money that we get from the teens, from the supermarkets. We write proposals. We have Friends of Hospice, where you are one of them. And our chief of staff has been a hospice friend for many, many years. I can't even remember. And so we request, we have come to say thank you for the support you've given us, and also lobby for more support.
So I think you have the right person. You don't have to emphasize these things, Gladys, Bwana GK, and Bishop, because we've lost our people, very close friends. Myself and Stephen Getonga, the most recent loss that happened is of a man that we knew, the principal of Maua Nursing School, Maua Methodist Nursing School. A man that we've been with. He has helped the community, supported the hospital, and he just went last year. So I think you have the right governor in the office. You have one of you. Or we have one of us. We have one of us because I've been agitating and also requesting, including the president, to help us establish a cancer research institute in Meru. And I have good news for us, not for you, for us, because we are all affected. That we have an institution by the name CPF, County Pensions Fund, that are willing to extend a loan to Meru County government. These are the people who manages county workers' pensions fund. They have a component of for development. They are willing to help us with this, establish a cancer research and treatment center in Meru. That discussion is ongoing. I've instructed the Department of Health to establish a Directorate of Cancer Management. We didn't have such a directorate. Cancer was lumped with other diseases, non-communicable diseases, but now that cancer is becoming a real burden in all aspects in Meru, we must handle it as it is, and with the force that it is pressing us with an equal force. So we are establishing a cancer directorate, cancer management directorate, whereby we shall have a director for that purpose, and then cascade those services down to sub-county level so that we can manage these our patients. We are in the process of devolving cancer chemo administration. First, we are going to work on our center here, and then take these chemo administration services to sub-county levels so that we can take services closer to our patients and serve them with dignity, and also prevent the unnecessary cost of travels and the pain that come with a number of things because of the strain economically. Our people, especially the burden that is there economically on the family because of treatment, because of nutrition, because of travels, because of the cost around that. It is so high. So we must take these services closer to the patients. So it is my dream and also my prayer, of which I know it is also your prayer, that we take these services down to sub-county hospitals